Welcome everyone to the Office of Children's Mental Health briefing on our 2021 annual report on the well-being of children in Wisconsin. Hello, I'm Linda Hall, Director of the Wisconsin Office of Children's Mental Health. We appreciate your being with us today to learn more about this important topic and what we all can do to improve Wisconsin's mental health system in the state. But before we dig into the data, we are very pleased to have with us First Lady Kathy Evers, who has a message about children's mental health to share with us. First Lady Evers, welcome, and let me turn it over to you.
Thank you, and I hope everybody's feeling a little bit warmer today with the weather. So anyway, good morning, and thank you, Linda, for that introduction. As Linda mentioned, children's mental health is very important to me, and I've enjoyed my partnership, especially with Linda and OCMH over the past 3 years. This partnership has only become stronger since COVID reached our state, as OCMH is really focused on what families need in these tough times. Today, we're gonna hear what OCMH discovered in terms of the social and emotional well-being of our children. Their data helps identify what our kids need and how we can work together to improve children's mental health across our state. I will let others speak to specifics, but the findings are similar to those in a recent national report issued by the Surgeon General. The mental health needs in children were substantial prior to the pandemic, and those needs have only grown, especially for those most isolated and vulnerable. That's why this administration has made children's mental health a top priority throughout this pandemic. In addition to investing $19 million in the budget for student mental health, Tony has directed more than $150 million additional federal funds to the schools and out-of-school programs. This will help provide the support kids need now more than ever, both in and out of the classroom. In 2022, we want to continue to work with communities on improving the mental health of our children. The OCMH data and recommendations will help that. It's not just data, it's the data that supports action on behalf of the social and emotional well-being of Wisconsin's children. As Tony has always said, what's best for our kids is what's best for our state. In these trying times, I thank OCMH for their continued work to identify what's best for our kids. Thank you. Now I'm going to pass it back to you, Linda.
Thank you so much, First Lady Evers. We appreciate your message and your continuing support of our work on behalf of children's mental health. We value your partnership with us throughout the year and really look forward to continuing to work with you more in 2022. So thanks for being with us today and for your message.
Thank you.
Well, here's the agenda for our briefing today. First, we'll get into the data in the dashboard section, then share something of our collaborations around children's mental health, highlight some of our efforts around the mental health awareness and understanding, fill you in on our focus on the social connectedness of youth, hear from a voice of lived experience, and then consider your questions. If you have questions, please submit them in the Q&A section. We'll answer as many as we can during the session and follow up with more afterwards if necessary. Please note that our report is posted on our website. You can access it through our homepage by clicking on the icon in the upper right corner. And we also have posted a direct link to it in the chat. We're recording the session today, and it will be available soon after the briefing. Now for the data. Our Child Wellbeing Indicators dashboard begins on page 12 if you want to follow along. This year, we looked at 39 indicators of child well-being. We compare the Wisconsin experience to our previous Wisconsin experience, and we compare Wisconsin to the national average where data are available. This year, we added to our red, yellow, and green stoplight a light red to indicate a measure that seems to be going in the wrong direction, but the data are not conclusive, and a light green light to indicate that a measure seems to be going in the right direction, but again, the data are inconclusive. Please note that all data points are pre-pandemic unless they are followed by an asterisk. Now a word about our primary data sources. These are the ones that we mostly rely on. We use federal reports that provide state and federal metrics in the same way and on the same timeline to allow comparability to the national level and across states. We do this because so frequently we are asked how Wisconsin is doing compared to other states. So we want to be able to give you a good picture of that. The trade-off is that sometimes the data are older and some metrics you may see in other Wisconsin state reports may vary from this. So we grouped the 39 indicators into the 4 categories used for the county health rankings, which you see on the left side of this slide here. Health behaviors, social and economic factors, clinical care, and quality of life. The county health rankings, of course, that provides a lot of data at the county level. And we know that many people in the state use that information for applying for grants, for understanding what's happening in their community. So it's another reason for us to be in sync with those county health rankings. On the right slide here, you see the indicators, criteria for indicator selection that we also use. Let me just say another word about the county health rankings. They are based on a model of community health that emphasizes the many factors that influence how long and how well we live. So next I want to highlight a few of the indicators from each of these county health ranking categories. So beginning with health behaviors. Here we see that cyberbullying showed no change during the reporting period. However, it's interesting to note that national research shows a large decrease in cyberbullying during 2020 when schools were remote instead of in person. Electronics use was up, and that's going in the wrong direction, which is especially concerning since this data is before the pandemic when kids were at home and having virtual school. Moving on to social and economic factors, we wanted to highlight here difficulty with social skills, which is continuing a concerning downward trend. And this isn't just about kids being able to chat after school or be the most popular person at a party. These social skills are critical for developing trusting relationships that are key to learning and belonging. Next is high school graduation. Wisconsin was one of the top ranked states in graduation in 2018-2019. Yet it also had the nation's second worst Black-white disparities in this category. The good news with this measure is that 2019-20 DPI data show that Wisconsin was able to maintain high graduation rates into the pandemic. The third item here, school connectedness, shows the pre-pandemic drop in school belonging. This was already a challenge for schools and for children before the disruption of virtual school and COVID quarantines. So this is very concerning. We'll be talking more about connectedness later. Under clinical care, we see all green indicators. However, while the number of mental health professionals has increased, the numbers fall still far short of what's needed to address demand. After mental health professionals on the screen, you'll see children with mental health conditions who did not receive treatment and mental health hospitalizations. While these figures seem to be going in the right direction, they don't yet reflect the past year's increased hospitalizations, worsening bed shortages, and emergency room boarding of young people in crisis that have prompted the declaration of a national youth mental health emergency. Under the quality of life section, the key measures seem to be going in the wrong direction again. Children with a mental health condition, high school students feeling sad or hopeless, teens considering suicide, and suicide attempts. Again, these figures don't yet reflect the increased mental health concerns and teen suicide attempts documented since the start of the pandemic. Now, as discouraging as this picture is, we want to note that Wisconsin is not alone. In December, U.S. Surgeon General Vivek Murthy issued an advisory declaring youth mental health to be a national crisis. In an accompanying report, Protecting Youth Mental Health, he offered national pre-pandemic data that portrays a very similar picture to what we have shared here about Wisconsin. The Surgeon General's report is over 50 pages with 27 pages of recommendations. There are roles for everyone, from parents to health insurers to employers and to government. Wisconsin has efforts in many of the areas that he recommends, but there is much more we can do to support our youth to be healthy in mind and body. And we're really going to be calling on people to come together and get engaged even more in terms of addressing this crisis. Now, turning to our demographics pages, which you will find on pages 10 to 11, this year we focused on the pandemic and we offer some data that provide more information on the emerging picture of how pandemic-related disruptions have upended life for many children and families throughout Wisconsin and deepened existing disparities. We've organized this information into these 4 categories that you see here: economics, education, parental stress, and child and youth mental health. So, starting with economics. In the first few months of 2021, about 40% of Wisconsin families with children reported losing employment income due to the pandemic. Throughout the pandemic, Black and Latinx families have been generally more affected than white families. Housing stability remained a concern for many families, with 10 to 15% of Wisconsin families with children having reported little to no confidence in their ability to pay the next month's rent or mortgage. National data also show that Latinx and Black families have been hit particularly hard. Looking now at the next category, childcare, from January to March 2021, 2/3 of Wisconsin families with school-aged children reported that at least some of their children's classes were online due to the pandemic. In the summer of 2021, about 1 in 5 families with young children were experiencing pandemic-related disruptions to childcare. And coming into this 3rd school year affected by the pandemic, both educators and students anticipated potential challenges around meeting heightened economic, social, emotional, and academic needs, with students of color expressing the most concern. Parental stress is another critical factor because when parents are stressed, kids pick up on it and often become more anxious. In this category, we see that adult mental health needs are down from earlier points in the pandemic, but they're still high. Almost half of Wisconsin parents reported frequently feeling down, depressed, or hopeless. So very concerning. Continuing on with this category, we see that alcohol sales increased 17% during fiscal year 2021. The number of opioid deaths increased 34% from 2019 to 2020. And domestic violence deaths have increased, as have both intentional and accidental gun deaths and injuries among children. Now a couple of data points about teens and young adults. Let me mention here that we monitor youth all the way up to age 26 because young brains are still developing in those early 20s, and these young people are still launching into adulthood. So we take that very seriously, and we look at that as a part of the lifespan that we examine for children's mental health. With teens and adults, we see that more teen girls were treated for suicide attempts than before the pandemic, and at least 1/3 of Wisconsin's emerging adults experienced anxiety. So to summarize, the pandemic has been rough on kids, especially kids and families experiencing lost income, housing instability, or food insecurity. We see the continuation of the pre-pandemic years-long trend of increased anxiety and depression among youth. We see investments made by Wisconsin to increase the school social worker, counselor, and psychologist workforce have made a difference, but the current supply still does not meet the treatment demands of our youth. All this is so concerning because we know that untreated mental illness as a child has lifelong negative effects for adult health and well-being. We need increased attention, collaboration, and support from state, county, and community leaders to address this crisis. Well, OCMH is also responsible for going beyond the data to identifying ways to improve child's well-being. And now we're going to shift gears a little and talk about what OCMH has done along the year with throughout 2021, along with our partners, to make a difference for kids and families. At this point, I'm going to turn it over to Karen Katz, our operations lead in this area.
Hey, thank you so much, Linda. And as I look at the participant numbers here, we are absolutely delighted to have each and every one of almost 200 people joining this briefing. And we thank you for carving time out in your day to hear this important information that we're sharing. I'm going to just share a little bit about what OCMH has done, as Linda mentioned. And a great place to start is we do our work through a collective impact model. And so that means we bring people and organizations together. Their commonality is that they're focused on children's mental health. When you total up all those people, we have 195 people and organizations involved in our work. And these are all people who are passionate about children's mental health. These 195 people participate on one of our collective impact groups. So we've got 2 councils. We have an advisory council and we have a collective impact council. And they also participate in our work teams. And you'll see here we've got 4 work teams: access, infant toddler, resiliency, and trauma-informed care. And what I do for the office is I really manage those work teams. So I know pretty much all of those 195 people and really outstanding individuals on every single one of our groups. We've also developed a number of excellent children's mental health tools, and I'm going to highlight here just a few of them. And I'm hoping that many of you are familiar with our tools. The first one I'll talk about is our mental health crisis card, and that's a tool. It's exactly what it sounds like. It's a card. It's a wallet-sized card, and it's a tool for people who are in a mental health crisis or agitated state to be able to communicate what will calm them. And in the 2021, Wisconsin Attorney General Josh Kaul announced support of the card, and that created a huge energized interest in the card. The card was already really well recognized in the state. It's implemented in many schools throughout our state and other child serving organizations. And these tools, by the way, are on our website. The feelings thermometer, I think everybody on this call is probably familiar with, and it continues to be just a fantastic tool that promotes understanding and managing feelings in a very user-friendly way. It basically identifies ways to shift your mood to feeling happy, calm, and content. And in 2021, we're just so pleased that we were able to work with First Lady Kathy Evers again on this project when she interviewed a number of families and they told their story of using this tool. Also, interest in the thermometer just continued, and we distributed an additional 15,000 throughout the state, and the tool is now available in 10 languages. So we're really proud of that. Children's Mental Health Awareness Day in the state of Wisconsin was May 6th, and Governor Evers issued a proclamation recognizing this. We were able to coordinate a group of state partners and held a number of virtual activities that first week of May. Social media images were created and made into posters for schools and community organizations to display. And the whole goal of all this was just to build better understanding of the diversity of mental health. And lastly, what I'll mention here is that OCMH had the privilege of partnering with the Department of Public Instruction, and we developed a free mental health resource that provides lesson plans for 3rd through 5th grade students, middle school and high school students. And these tools are all focused on coping skills and how to talk about mental health. The new resource was co-created by parents and youth with lived experience, mental health experts and advocates, and educators and school staff. Here, I also want to share that we provided a number of opportunities to hear from people with lived experience. The first was the Voices of Wisconsin Students Project. Here we supported the Wisconsin Institute for Public Policy and Service Research Partners as they held focus groups with Wisconsin students throughout the state to see how they were coping with school and learning during COVID-19. Here, youth boldly identified their sources of stress and anxiety, as well as the support they needed and how they have been able to build resilience. We also gathered diverse mental health clinicians to share experiences in 2 OCMH listening sessions. The first was held in May, and where we asked clinicians to share their thoughts on working during the pandemic and times of civil unrest and community unrest. And the second session was held in July, and we explored clinicians discussing cultural sensitive supervision. We also held 2 virtual listening sessions for youth across the state to share their thoughts on intersectionality and the impact of social media. We will continue to work with the Wisconsin Office of Violence Prevention and the American Foundation for Suicide Prevention to explore the impact of social media. And lastly here, I want to talk about our resiliency team. They're one of the 4 teams I mentioned earlier, what they did in 2021. They did a thorough analysis of 2 listening sessions that we held in 2020 with youth. And they followed a human-centered design process. And the outcome of that was developing recommendations for action based on the insights that the youth shared. And these are the whole purpose of this recommendations for action was that organizations will read them and incorporate these into their policy, practice, and their culture. Lastly, I'm going to talk about lived experience. And if you know our office, you know that this is one of our grounding foundational pillars. Lived experience people, they share their voice and perspective to transform systems to better serve children and families. We have 2 categories of lived experience. We have parents or caregivers, and then we also have the children themselves, youth. And we're going to have the privilege of hearing from one of our lived experience partners in just a little bit. They work hard. And in 2021, they presented 7 times and engaged over 320 people ranging from social work students, therapists in training, student services staff, mental health advocates, and parents and leaders. And I'm just going to finish by something we're really proud of here. In 2021, we began to pilot a lived experience academy. And what this is it's a 3-year structured pathway for parents and youth leaders to build their knowledge and connections in children's mental health. So the first year we started in 2021, and that first year is where participants receive trainings on interpersonal and system level topics influencing children's mental health and well-being. In years 2 and 3 of the academy, they will start participating in our collective impact teams and councils, which I mentioned earlier. So that's just a little bit about what we've been up to in 2021. And now I am going to ask Linda to take it from here.
So thank you, Karen. And I think you all can see that we're bringing people together to increase our understanding of children's mental health beyond the numbers into the real world and to understand their experience as children and families of our mental health system. As I mentioned earlier in our work, our focus on children and young adults across the lifespan goes birth through age 26. And in 2020, we really dove into identifying the key mental health issues at each stage of life along this span. In 2021, we dug into the data on each of these identified problems and what was being done to respond to them. Then, in turning to our collective impact roots, we knew we needed to identify the one thing that will address all these problems along the lifespan. The one thing that we can organize around, that we can engage people across all sectors to work with us to leverage change for kids. After reviewing our indicators on children's well-being, talking with many in our network, and thinking this through with our Collective Impact Advisory Council, we decided on social connectedness of youth. We introduced this to our councils and teams in 2021, and reached agreement to focus on it in 2022. Our working definition you see here on the screen is: youth are socially connected when they are actively engaged in positive relationships where they feel they belong, are safe, cared for, valued, and supported. We developed this working definition from looking at the Centers for Disease Controls and Prevention, the Center for Disease Control and Prevention's work in this area. They've done a lot of work in this area, and they have developed a more technical definition. We wanted a definition that really resonated with people and would come alive as we started to work with people around this agenda. On the left side of this screen, you see that the outside circle, it represents those 195 people and organizations that Karen mentioned earlier. And the inside circle defines the areas of social connection where organization can support kids in building connections. So we think that most of our network can find themselves in their work with or on behalf of youth somewhere in this circle. And so in this circle, you see supportive adult, family, cultural identity and community, school and earlier education, and peers. So we plan in 2022 to reach out to our network and beyond and encourage people to increase their efforts around social connectedness of youth, and then to share their strategies and successes with us. Now we're going to turn our attention to the lived experience portion of our agenda, one that has been very popular in previous briefings. And today we're going to hear from a young adult with lived experience. And now it's my pleasure to introduce to you James Hulse from Waukesha County. James is a relatively new lived experience partner with OCMH, having just started in our new Lived Experience Academy that Karen mentioned earlier. He's working on bachelor's degrees in business administration and cybersecurity. He's also a leader in the Future Business Leaders of America at both the state and national levels. James is going to share with us a story of recent experiences that highlight the power of social connections and mental health literacy. James, take it away.
Thanks, Linda, for the introduction. The first training event I attended as a youth lived experience partner at OCMH covered youth mental health first aid. I learned valuable information, but thought to myself, I'm just a college student. When will I use these skills? As it happened, the timing was incredibly fortuitous. Within mere days, a chance encounter would prompt me to take action. Late one night, a fellow student started to make dark and disturbing comments in an online chat room. Recalling last week's seminar, alarm bells rang in my head. I knew that this behavior could signify a crisis. Acting in my uneasiness, I attempted to get the attention of other familiar users or moderators for assistance. However, none responded at the late hour. At that point, I had to make a decision. Do I try to take action myself, or should I just go on with my night? Besides, I didn't know this individual. Was it indeed my role to get involved here? Surely someone closer to them will be much better positioned to intervene. Despite my doubts, I knew that I couldn't turn away. I had to ensure the safety and well-being of my fellow student. This is a decision that I will remember forever. Quickly, I sent them a private message expressing my concern and inquiring about their status. Then, in a move that seemed surreal, I asked if they were thinking about hurting or killing themselves. This felt like an incredible question to ask a stranger. However, as I learned in my youth mental health first aid training, asking this question quickly and directly is vital. Just a few seconds later, I received the answer. Yes, they replied. They were thinking about killing themselves. Furthermore, no one else was aware of the situation. Suddenly, a rush of emotion overcame my initial trepidation. Though initiating this conversation was definitely the right move, I found myself unprepared to respond. I am not a mental health professional and had never done anything like this before. Possible courses of action ran through my head. As a person with lived experience, I know that making a 911 call could bring a rapid response, but it's not always the best option. I prepared to contact the University Police Department if the circumstances demanded, but was wary of bringing law enforcement into a mental health crisis situation. Ultimately, I simply had to engage in a conversation, offering peer support and reassurance. My fellow student just needed someone to be there with them as they experienced a tough time. We talked for several hours that night and again on subsequent days, working out a safety plan and connecting with university resources. Several months later, we still touch base from time to time. Now they are in a better frame of mind and receiving professional help. More broadly, I hope that this story reminds others to check in with their fellow humans and take action when they see warning signs of a crisis. My determination to step in on that fateful night forever altered the course of a fellow student's life as well as my own. I wasn't the only person to see the troubling messages, but I was the only one to address them. Truthfully, before my training, I may have shied away from the situation as well. Now, I know that helping someone in a crisis is something we can all do. Take action when something seems wrong. Start by establishing a dialogue. Listen non-judgmentally and offer reassurance. Connect with appropriate family, community, and professional support. You can have this conversation, and it's vital that you do. Directly asking about suicidal thoughts or self-harm sounds intimidating and taboo, but actually enables the conversation by expressing your concern and overcoming shame. 2 months later, under almost identical circumstances, I assisted another student in their crisis situation. Again, it was a conversation I'll never forget. That led me to wonder how many people in a society are struggling unseen. The past few years have been very challenging for many of us. When the emergence of a global pandemic thrust our learning and work online, institutions scrambled to deliver material in new formats. Left out, I fear, was a hidden curriculum of social-emotional learning and interpersonal relationships. Without supportive peer connections, who will notice someone in a crisis and take action? That's why we need to build check-ins into our routines. Save time for these necessary conversations in your work and personal life. You could be the one to make the difference for someone else. Thank you.
You know, I'm just going to pause a minute here. This story that James shared with us is just so powerful. You know, I did a mental health first aid class, and I can't say that I've used what I learned there in the same way that James did. His courage and his skill in turning and recognizing what was happening with these online classmates, and and responding, having the courage to start the conversation, and then to do the follow-up. Simple actions in some ways, but as I told James when I first heard it, heroic. And you have made such a profound difference in these young people's lives, and you are an example for all of us. I think you if you take a look at the chat, you can see that people are really amazed and getting chills with hearing your story. We are so thankful to have you to be a lived experience partner with us at the Office of Children's Mental Health. And we look forward to continuing to work with you and learn from you in the weeks and months ahead. Thank you so much for sharing your story with us today, James.
Thank you, Linda. Thank you everyone for your thanks in the chat.
Thanks, James. Okay, now it's time to turn to your questions. We've had a couple of questions in the chat that I will can start with. One was on the indicator on the difficulty of social skills. What age group does that apply to? I would have to double check that, but I think that we're talking, we are looking at that particularly with the young children, sort of elementary school level children. But I think that it actually goes from 6 up to 18 or 19. So it doesn't really include the very young 0 to 5 kids. We are concerned with that 0 to 5 group that the behaviors that are leading to expulsion have something to do with mental health and the stress that those kids are under. It also is an area where we are going to want to work with others to support the adults around children and having the skills to understand what's going on with the kids, and to understand, to have tools in their toolkit to respond to what it is they're trying to tell us through their actions. So that's an area that we are going to continue to be involved in, and we will be partnering with lots of other leaders in that area. Another question was about the pandemic, more about looking for more on the pandemic and what's really the problem there. And I would say that, our message here is that what was happening with children before the pandemic has just been exacerbated by the disruptions that families have experienced during the pandemic. We have been seeing a 10-year plus increase in anxiety and depression among children. And we have seen that, that data that we looked at last year showed that it can be on average 11 years before children get responses and treatment once they've been starting to exhibit symptoms of mental health and mental illness. And so, you know, it's not a new problem. Our conditions are the same but it's increased because there are more kids needing help. Just as all of us adults have been more stressed, and adults have been talking more about mental health, it's happening with children. So we have a bigger issue. Fortunately, we have people realizing that this is an important issue to address. And so in some ways, there are more children reaching out for help, and that's a good thing. We need to figure out how do we respond to all of this increased demand. Because as we described earlier, we do not have sufficient numbers of mental health professionals to address the entire demand. So that is why we have been focusing on this social connectedness, because we see that this is a way that we can all get engaged in helping to provide safe and stable relationships for children that will help them weather the traumatic experiences and the upheavals that they and their families are experienced during the pandemic. So, and I see, I'm going to look here, we got a couple more questions. There was a question about the mental health crisis card. And Karen, you want to speak briefly to that?
Yeah, I did. And so thank you, Linda. And I did put a link that takes you on the crisis card to our website. We have a lot of information on our website, but basically it is such a simple idea. And I think that's why it has taken off. It is a wallet-sized card that youth or adults can carry. And one of the most beautiful things about this card is it empowers the voice of the youth or the person carrying the card, because it states on the front 3 calming strategies so picture it. If somebody is in an agitated state, has the card, they can present it to anybody, a fellow classmate in the school counselor, someone at the bus stop. And someone can easily read it and do what the youth requests to help them calm down. We know that we don't want those situations, the agitated states, to grow into a crisis. It never ends well. And if we can calm the person down, the outcomes will be better. It empowers their voice. So that's in a nutshell what the card is about. Youth can fill out a card, carry it in their phone wallet, carry it in their wallet. They can take a picture of it and just show it to people around them in the moment. And again, I've had entire school districts that have handed the cards out at the beginning of the school year. We've implemented it in student organizations. Right now, you don't even need to talk to us to implement it. You can go on our website. The resources are there. There's the card you can download and print. But I did put my email in the chat, because I am so happy to work with any organization that wants to implement the card in their organization.
Thanks, Karen, and thanks for leading that initiative for us. It's been exciting, and we see it growing. We're getting more requests for it, so we are looking to see how we can impact kids through that methodology too. I'm looking at a couple more questions that are in the chat. One is about rural children and teens and young adults experiencing disparities. Are there specific initiatives for them? We would say that our initiatives, we think, apply to kids in all different settings. So in urban and rural settings, we are always looking, as we look at data and we consider where we're doing outreach, we try to do it in rural areas as well as urban areas, and think about the specific questions that kids there may have. But I really think it in such a large part, it really gets back to having these safe, stable relationships for kids and having supportive adults that they can turn to. And so that happens and needs to happen no matter where kids are. If you, I know that this question is from one of our partners. So if you have particular ideas, Pam, on things that we should be looking at, we'd be happy to hear from you and try to follow up on them. Aaron asked about the data on 40% of kids with mental health issues not being able to get help. Were these kids actually diagnosed, or just kids with some kind of behavior or other issue showing? That 40% figure addresses kids who are diagnosed. So it's a serious issue. And just to make another comment about this issue around the mental health workforce shortage, we know that we can't fix that very quickly. That is going to take, a long-term approach to increasing the number of mental health professionals. And so, again, this is why we are looking towards other activities that we can be engaged in that will help to address children's mental health and to support them in the interim. We, in addition to some of what you've heard today, we are very active in the school mental health arena because we see that there is a lot going on there. Schools are interested in addressing it. We're hearing from all kinds of partners in communities that they think that school is an important place to help students. And we are also really actively looking at youth-led initiatives. So there are a number of programs where youth really lead in their school discussions about mental health to reduce stigma and learn skills to support friends and peers. And so we are in the process of identifying more of those programs, and we'll be holding that information out for others to learn from. And we also hope to increase the number of youth we are working with and advising us on what to do. And they're telling us that there is much to do at school, and that they have ideas about it. They're interested in being tapped to help lead those ideas and initiatives at school. Okay, and then let's see, we have a question about, we have some ideas from Pam, I think it is, about increasing ADHD among, there is an increase in ADHD among children and families. Children are a few years behind socially and struggle to fit in with anxiety and that. Yes, this is one of the reasons why we're looking at a longer time frame for kids, is that we want to be sure that we're covering kids who have emerging issues and that they get the attention they need so that they can start as adults on a solid footing. Let's see, have I missed anything else? Karen, have you seen anything else in there? We have another question here. Are there silver linings when it comes to the data? What we know is working is when kids are connected and when they feel like they belong. We know that a few schools and counties in the state have really looked at this issue of kids belonging, and they have initiated things in their community to address mental health and to provide support for kids and for their families, and they see those numbers changing. So we're going to be looking for more of that. Our whole initiative around social connectedness is really, we want to go beyond talking about it. We really want to see that we're going to be moving the needle on it. And so some of the factors we're going to be looking at is, are kids feeling more connected? Are their social skills, their ability to make and maintain relationships, are those improving? Because the research tells us that those are the things that make a difference for kids. Let's see, Tracy Order is asking, collectively, what are our steps? We would say our next step is to really work on this social connectedness. Please join with us in thinking about this, thinking about what you are already doing with kids that you could do more of and extend to more kids in your community. How can you partner with others in your community to really pay attention to the social connectedness of kids? And as the 2022 continues here, we're going to be rolling out more specific ideas on what you can do and how you can focus your efforts around this so that we can get kids more connected. Let's see, there's a lot going on in the chat box here. John Ashley is saying many schools have embraced community schooling as a way to elevate student voices around the topic of mental health. Yes, it's another important activity. I think that when we create the conditions for our kids to feel supported, get support from parents, from adults outside of their family, if they need that because their parents are stressed, that we can help kids and we can provide a brighter future for them. Karen, did you see anything that I missed?
Linda, I did not. So I think we might be at a place where you can wrap up and give hope for 2022.
Okay, let's see. All right, we've got one more thought coming in. Hope Squad, yeah, Marty is talking about Hope Squad. Hope Squad is one of those youth-led groups that I was mentioning before. And it's one of the initiatives to help train youth about mental health and to train them how to support their peers. You know, and that again is, we're working on that issue through these kind of groups and also through that mental health literacy curriculum that we partnered with DPI on. It has very specific things that can be taught to kids of all ages. So there's a unit of instruction for elementary school, another one for middle school, and a third one for high school. And you know, in terms of things you might do in your community, you could ask them to pick up this curriculum and start using it. So with the youngest kids, it's teaching about mental health, what they need to know about mental health. And we really went to having a curriculum for the youngest kids because our teens told us that we asked them, when should we start talking with kids about mental health? And they said, as soon as they come to school. So we've got that curriculum has an elementary school curriculum. It does things to help kids understand where they can go for help, to learn about the resources in their school. We're hearing that some kids are not familiar with the resources that they have at their school. So that is important. And then it also helps them to know how to reach out and support kids, to do the kind of thing that James did, to do it in an informed way, to know, how to support somebody and when to pass them on to someone else who can help them more. So with that, thank you, Representative Billings, for your encouraging remark there. We encourage you to stay connected with us in 2022 to learn more about social connectedness of youth and how you can do something in your community to make a difference in the lives of the kids in your community and in the state. We thank you for being with us, and we look forward to hearing from you. Always happy to answer questions for you and look into some more data if there's something that you're interested in. And with that, I'll just say stay safe and be well.